I was just gonna say I'm gonna record it now.
All right, awesome. All right, thanks everyone on the other side of the webinar for joining. We are really excited to share the release of our Extreme Temperature Response and Resilience Guidebook. This is a guidebook intended for municipalities and community-based organizations to help increase resilience to extreme temperature events. So for a little on today's outline, there's also a QR code in this bottom right um, that you can take a look and view the guidebook um, and download some other resources. All right, for today's outline, we'll do a brief introduction to our climate and health team, which does this work, as well as going through the guidebook purpose evaluation process, and then the content. And then we'll also share a little bit about how to use this resource or pass it on, and hopefully we'll have some time for questions. All right, who we are. The Maine CDC Climate and Health Unit is part of the Environmental Health Program, and that's within the Division of Environmental and Community Health at Maine CDC. It's funded through a cooperative agreement with the US CDC's Climate Ready States and Cities Initiative. This is also known as Building Resilience Against Climate Effects, BRACE. And the team that is joining us today is Rebecca Lincoln, who's the Senior Environmental Health Program Manager, myself, the Program Coordinator, and then Erin Arneson is on as well, who is our Health Communications Specialist. All right, so why did we create this guidebook in the first place? It is meant to offer practical tools and strategies to help local leaders plan, prepare, and respond to extreme heat and cold. We, as a climate and health unit, are looking a lot at broadly at weather-related impacts of climate change in the state of Maine, and extreme heat is probably one of the number one public health threats nationwide. And it's a growing issue for Maine as well, and one that Mainers are likely not that well prepared for, considering that we aren't a very hot weather state. And we are also a cold weather state, so we wanted to build a resource for communities across the state that help people respond to both summertime and wintertime risks. And it turns out that the response strategies for those things are actually pretty similar. So this is a packet that covers both ends of this extreme. It goes over health impacts, preparedness options, an event response, and then also some long-term strategies. And there's a lot of different additional materials and supplemental resources in the appendices as well. So a quick look at the guidebook sections. We won't go in depth into all of these today, but please take a look at the guidebook yourself after this webinar through the QR code, or as Rebecca said, we'll share the link out afterwards. But broadly, an overview of extreme heat and cold in Maine, those in response options, long-term strategies for building resilience. All right, so extreme temperatures in Maine. Maine's climate is somewhat unique in that we experience both extreme heat events and extreme cold events somewhat regularly. And it's likely that both of these might become more extreme as climate continues to change. In this graph on the right, you can see average annual land temperatures in Maine since around 1890 to 2020. And we can see from that line that those average temperatures are clearly increasing over time. I think this gives a good average temp broad overview of Maine as a state. And then diving a little deeper, we also collect cold-related illness and heat-related illness emergency department visit data. We've been doing this since about 2001, and this really helps give a visual of the actual health burden of extreme heat and extreme cold in our state. So on the left, we can see we experience about 200 to 500 cold-related ED visits per year. And for reasons we haven't entirely been able to pinpoint because cold can be a little harder to predict, those emergency department visits for cold are increasing over time. We can see that It's highest by quite a bit in 2018. Extreme heat on the right, ED visits jumps around a lot more, even though average temperatures are increasing. The emergency department visits can really depend on just how hot of a summer it is, among other factors. But we can still see an increase in 2018. All right, so just to quickly touch on not just past data, but also projections for the future, since that's just as important for preparedness. We also see that hot days are expected to continue to increase. This data is from the climatologist office done by University of Maine Climate Change Institute, and that research is suggesting that the number of days with a heat index of 95 or more is predicted to increase in Maine. The map can show that change based on area, but on average, it's about a 2 to 4-fold increase between 2000 and 2050 that's expected. And that heat index value is not just temperature, but a measure of temperature and humidity, kind of like a feels like temperature. It's a lot more indicative of health impacts of heat. All right, so a quick touch as well on defining extreme heat and cold. This is really in the bucket of the National Weather Service. They have both heat event warning criteria and cold event warning criteria broken into advisory, cold watch, and cold warning. And the heat alerts are the same across the state. The cold alerts differ based on region, the thresholds, that is. And you can see the two different forecast offices. There's Caribou in more of the northern part of the state and Gray in the southern western part of the state in this map on the right. And that just takes into account the temperatures that each region is more used to and more likely to be prepared for, because we can see different health impacts from that. So northern areas of Maine that experience more cold have a slightly different threshold for actually issuing an alert. It's colder than the southern parts of the state. All right, so the guidebook also goes pretty in depth into the impacts, the health impacts of extreme heat and cold. A brief overview right now, since we're somewhat limited on time, I won't go too deep into the actual health impacts themselves, but definitely take a look at those sections within the guidebook. Goes into detail about the symptoms someone might be experiencing, the response, and also what these illnesses might look like. But both direct and indirect health impacts are important to consider when we're talking about these kind of extreme temperature events. And those ED visits, that data that we collect really is only a snapshot of um, acute heat-related and cold-related illness. There's also a lot of other ways that extreme heat and cold can impact health everywhere. And it can often have compounding impacts when it overlaps with things like power outages, storms, floods, smoke events. And the guidebook goes into some of those compounding factors as well. So people who might be at higher risk from extreme temperature, there's a whole section of this in the packet that describes different groups that might be at higher risk and why. A few of them are people who are just highly exposed to different temperatures, either through work, housing, or recreation. That can include people who work in hot indoor environments or outdoor workers. Outdoor workers especially are a population we see a lot in that ED visit data in the summertime. Also unhoused populations. This is also a population that often comes up in those ED visits, especially for extreme cold. Also, first responders, outdoor athletes. There's also folks who are just highly sensitive to extreme temperatures physiologically, like older adults or children, people with chronic health conditions. And then limited resources can also really increase the impact of extreme heat and cold. And that is anything from not being able to pay heating or cooling bills, limited transportation, maybe to cooling or warming centers, people who are socially isolated, and also information barriers can be big, especially if that's language or technology. We hear from more rural places that it can be hard to communicate in any kind of mass way to the population about um, cooling and warming centers that are open or the health impacts and things like that. So, a quick question for you. I guess, is there a chat function where people can put this in the chat? I guess not. So maybe just something to think about. Is that right? Something to think about. What populations are more vulnerable in your community or region? This can really vary based on um, rural, urban, what area of the state, coastal, inland that you live, what organizations you're a part of.
People could put it in the Q&A box if they want, if they feel like answering, but no pressure.
Right, so jumping into really what is the meat of the guidebook, these preparedness options, response options, building long-term community resilience. So section 6 goes into preparedness options for extreme temperature events, and we break these into public preparedness and organizational preparedness. The public preparedness section focuses more on building awareness of these types of events that can look like social media campaigns or other kind of communications materials, while organizational preparedness is more about organizations actually developing a plan, encouraging municipal partners like community-based organizations, local businesses, schools to develop and adopt extreme temperature response plans and procedures, particularly those that serve or interact with people at high risk for those health impacts. And developing a plan ahead of time can really make a big impact. All of the time spent preparing means when the response is actually happening, it might be a lot smoother. And you can create and exercise these plans using steps laid out in the guidebook. To dive a little deeper into public preparedness, this can mean raising awareness seasonally or in preparation for a specific extreme temperature event. It can be developing or reposting messages, including information about location of warming or cooling centers. Some potential communication materials could be things like brochures, tip sheets, magnets, social media graphics, or posters, and potential communication channels can be something like a local press release or posting information on a website, MEMA's website, social media, a radio broadcast, or email distribution lists. There's a lot of different options, kind of depending on your community context and the resources that you have available. So, on to organizational preparedness. This is really that developing and adopting an actual plan. So, for municipal leaders, this might look like including information about cooling and warming centers and the kind of like triggers or thresholds for when and how they're going to be opened. Schools, camps, youth organizations can include things in their plan that might designate when to close buildings or when to modify activities like a sports practice. For employers, it can be things like shorter, including plans about shorter work rotations, more breaks, whether appropriate gear might be useful or appropriate, and how workers will stay hydrated. For healthcare, it might be outreach to higher risk populations. Police departments might be things like wellness checks, um, or fire departments. And then communities, we've also heard some neighbor to neighbor, either informal or formally, just check in community networks that help make sure that people, especially maybe older folks who might be more socially isolated, um, know when an extreme temperature event is happening and know what resources are available to them to stay safe during that time. So that was more preparedness ahead of an event, and response options for in-event response is also in the guidebook, and that can really is often a multidisciplinary effort to provide direct services that meet health and safety needs. And there's also a lot of recognition that some places, one person like the town manager might be wearing a lot of different hats, like might also be the fire chief and some other things, and that can really stretch resources. So using resources that are already available or networks that already exist can be a really helpful strategy, and just communicating clearly with the public and partners about the response actions that you're taking, what the plan is, and the channels that you plan to communicate within. And these can really be scaled up or down and will greatly vary based on context. But a big one is opening and operating local cooling and warming centers. This graphic really gives a good picture of how in-depth some of the sections of the guidebook can be. So I wanted to include it, even though it's a lot of words, but there's both formal and informal options. Formal often looks more like a library or a town hall, fire stations, and then informal can also be it might not be open through specific hours, but you can still communicate that this coffee shop is open and has agreed to operate as an informal cooling center, or a bookstore, or places of worship can also be a big one. And again, this can really, really differ based on different contexts and rural versus urban scenarios. But for those formal cooling and warming centers, those should always be reported to Maine Emergency Management Agency, and they keep a running list of those and send them out to the people who need to know about them organizationally. And actually, all formal and informal cooling centers and warming centers should be reported to MEMA, and the information to do that is also included in the guidebook. And we also include, I didn't include it in this presentation, but there's also some temperature thresholds for opening cooling and warming centers to consider laid out in the guidebook, both for temperatures, especially for heat that might be before a National Weather Service warning gets put out, but also different actions you can take at each of those thresholds. Another great option is just creating accessible outdoor spaces and amenities that can include splash pads, fountains, awnings or tents, outdoor heaters, water distribution sites, or just like extended operation hours. These can have maybe less of a financial barrier and sometimes less of a staffing barrier than cooling and warming centers can have. So are an important resource in addition to those cooling and warming centers. They can just help expand access to cool and warm areas and also reach populations that might not be willing or able to visit an indoor cooling or warming center. We've heard a lot that sometimes municipalities will open cooling and warming centers and people won't go. And even though it's still very important to go through those steps so that when a extreme event is happening, we'll still all be prepared. Some people might not want to go inside for a number of reasons, if that's pets or not being able to bring your belongings inside or just being around a lot of people. So these accessible outdoor spaces and amenities can help just bolster, is another strategy in the toolbox to help expand access to what can be life or health-saving, cool and warm spaces. So another question to think about or put in the chat or just contemplate on your own is, how has your community or region responded to an extreme temperature event in the past? What has that looked like? Who's been involved? Have you been aware of it? The guidebook also includes some information for overcoming implementation barriers, just ideas on different barriers that might exist and strategies that might help overcome them.
Yeah, and feel free to put it in the Q&A. We got a couple answers last time. Yeah.
Awesome. Thanks, everyone. All right, so moving along, the eighth section of the guidebook is really about strengthening long-term resilience to extreme temperature events. This might involve updates to building codes, energy systems, things like outdoor infrastructure, and really depends on community context. But this kind of resilience planning can have a lot of additional co-benefits like reducing energy costs. For example, installing heat pumps can improve indoor cooling and warming and increase the efficiency of the building. And we also have a table in the guidebook that has a list of programs that can help support these efforts to improve the resilience of Maine's indoor spaces. And those options can also sometimes naturally link to other plans and initiatives like climate adaptation or resilience plans and objectives, hazard mitigation plans. So that can potentially expand funding opportunities and resources for implementation. A lot of the time, climate change adaptation from an environmental perspective also has really significant impacts on health and safety. We see that, for example, a lot with the heat pumps, both energy efficiency, but also protecting people from extreme heat and cold. So this is another table that gives a good idea of a lot of detail that's in the packet. Ideas to improve the resilience of both indoor and outdoor spaces. Everything from promoting or developing programs to improve energy affordability and organizing donation drives to reducing paved surfaces, splash pads, heat lamps. This long-term resilience can also, both funding and resources can be a big barrier, and also just the ability of communities to actually implement these things. So recognizing that there's a lot of barriers here, and we try to address that in the guidebook, but still give ideas of ways that communities and municipalities, based on their context, might be able to implement some of these more long-term resilience strategies. Um, and things like the Community Resilience Partnership grant. We also have a table of different grant opportunities, although those are somewhat time specific in context, like they might change. Year to year, we do identify some grant opportunities to give an idea of where different communities might access resources for this kind of work. And the last section of the guidebook before the appendix is the actual extreme temperature preparedness and response planning. This gives a step-by-step, it walks you through a 7-step planning process to develop a clear plan of action to actually respond to an extreme temperature event. It's much more like FEMA, Emergency Management Agency focused, a little more technical, a little more specific in its step-by-step, who to communicate, who, why, when, where, how, assessing resource capabilities, and then developing and actually implementing the plan. And there's some different, I think, exercises in there as well to talk about how to actually evaluate and maintain the plan as well. Some community level response action tables are also in there. I know this print is very tiny, but definitely look at them in the guidebook themselves if you got that QR code at the beginning, or we'll send it later on. This is based on each different NWS threshold and different community level response actions that might happen when those alerts are issued. So for example, if a heat advisory is issued, what different organizations might take action-wise to respond to that event, such as community-based organizations, first responders, um, and that's also for extreme heat watch warnings and same for cold. And I will also say, I think we have municipalities marked for each of those X's in that first column, and that's just because of the context of the guidebook being a resource for municipal leaders and organizations. And Rebecca, I think you had already switched the slide. Perfect. The appendix is also just a wealth of materials and additional resources. There's two, for example, that you can see on the right, a tip sheet on how to keep cool without air conditioning. If you can't make it to a cooling and warming center, if the power goes out for a number of reasons, you might need to use that information. And also a wallet card on recognizing and responding to the symptoms of extreme heat illness. There's also cooling and warming center guidance. There's different communications materials and guidance, including different infographics that are pre-made that you could use on social media or in a newsletter. There's different heat and cold measuring tools that might be helpful. There's planning development questions and guidance, and also a checklist for operating cooling and warming centers. And both the checklist, or at least the action tables that you saw in the last slide, those are also included as pull-out sections of the print guidebook. They're laminated, so you can check them, erase them, reuse them, and we'll provide a link for ordering print copies of the guidebook in case anyone is interested. All right, and quickly just to talk about options for sharing and using the guidebook. There are a lot of different options or steps to go from here. It could be distributing the guidebook to partners or relevant community members. It could be incorporating some of the recommendations into your organization's preparedness and response planning. And then we're also working on a training or briefing on the guidebook's content and application, something like this, hosting us at an upcoming meeting to discuss the guidebook, and also ordering print copies of the guidebook. And to quickly touch on another resource that we've developed, the Climate and Health Unit at the Environmental Health Program, is our Cool Down and Drink Up to Beat Maine Heat. This is a extreme heat communications campaign that is mainly centered on outdoor workers and those who work in hot indoor environments. And that population was mainly chosen because it was a population that was showing up a lot in the data as a highly vulnerable and impacted population to extreme heat. And this communications campaign includes both or all of workplace posters, there's handouts, there's employee and employer guidance, there's also different social media videos and images. So we ran this for the first time last summer and are running it again this summer. And any workplace can request materials from us, everything from those posters to different swag items like a sweat towel or stickers. And there will also be some radio ads and different communication channels that we used last summer. All right, that is the end. Thank you all so much for sitting through this 10-section guidebook. I hope that it was informative. I know that a 30 or so minute presentation can really only scratch the surface of what is in that resource, but you can view and download the guidebook online through that first QR code and then request a free print copy through that second QR code. And let us know if you have any questions.
Yeah, thank you so much, CJ. This was a really great presentation and very timely. Um, Again, if anyone has questions, you can drop them in the Q&A chat now, or you can raise your hand and we will um, allow you to talk in the Zoom setting. So,
And while we're waiting for questions to come in, I would just make another plug for folks. This is such a well designed resource. And South Portland, we just received our physical copy in the mail and we opened
mm,
it up, and it was like, you know, a really wonderful, beautiful resource to have. And we can't wait to dig in. So I really encourage everybody to go check it out.
yeah, and just the graphics and resources were so useful when we were also promoting um, the similar educational materials even last week. So yeah, they're awesome.
Amazing. Thanks, Megan and Carly. That's awesome to hear, and I'm glad it's been really useful.
Yeah. And Robin, if you want to kick off the Q&A section, go for it.
Yeah, definitely. So we have a question about cooling centers and how will many towns and municipalities set up cooling centers. The data shows that they're often underutilized. So we're wondering, what advice you have to help increase the usage of cooling centers or address barriers. Like I know you mentioned transportation barriers, communication barriers, but how to address barriers or why people might not be using the cooling centers.
Yes, this is a fantastic question and something that comes up a lot when we talk to different county emergency management agencies about opening and operating cooling and warming centers. A lot of people give the feedback that they open them and nobody comes. And that can be a lot of different barriers and really depends on different contexts, whether that's a more urban or rural area of Maine. And transportation is a big one, whether or not people can actually make it to cooling and warming centers, especially if it's overlapping with a winter storm or something like that. I think sometimes also awareness that they're open, communicating ahead of time that they're actually a resource that people can go to and use when they're open, why they're open, what it might look like when you get there. And if it's possible, having the same building or organization open each event so that people know that that is a resource for them. Um, Rebecca and Aaron, feel free to jump in with any other thoughts on this.
Yeah, I'll just add a little bit to layer on top of CJ's excellent answer and say that we do hear this a lot. And, it's not just here, pretty much every big city that opens these centers up routinely during heat events, often when they evaluate that usage, what they're finding is people are sort of only sporadically taking advantage. It's a lot of effort to stand these up, especially if it's not a well-oiled machine and you're doing it for the first time and figuring out the logistics. Um, and so, this is we recognize, I think, also that in Maine, people frequently are used to riding things out on their own, especially in more rural areas, that the preference really is to just hunker down and get through it on your own at home with your own resources and look out for your neighbors, but not worry too much about your own, um, you know, the impacts on yourself unless they get really bad. And so we wanted to provide resources for folks who would prefer to go that route, but also recognize that, especially from what we know of other really severe heat events in northern tier areas of the country in the last few years, that when the weather does get really bad, especially in areas that don't have a lot of air conditioning prevalence, that people really do, there's a point where people need to go someplace cool. And if they already know ahead of time that there are places that are going to be available and how to access them and what they're going to be like, it's a really important protective, preventive strategy in those really, really bad events. And other, Pacific Northwest, I think one of the big learnings that we've heard from that, how that heat event was handled, and what those municipal leaders experienced was a huge surge in demand for cooling centers. People, lighting up the switchboards at their version of 211, asking where they can go to cool down, that towns and cities were not prepared for and didn't have good answers for, and people really suffered in that heat event, and the morbidity and mortality impact was severe. So we want to make sure that even though it feels often like a waste of time and resources and effort to stand these up, that we practice doing it so that if we really, really need them, that people know where they are and will go to them when they get too hot at home.
I would just add that to what Rebecca was saying, people prefer to stay home if that's manageable. That's why we created a handout about how to stay cool at home without AC. And so it's about taking cool showers, doing a foot soak. And so we have that handout in the guidebook and that CJ showed to help people figure out, okay, I don't have AC, but fans at 90 and above aren't going to help me. So what are some other things I can do to stay safe?
Yeah, and I see that one of our participants, Tanya, makes a good point about combining cooling centers with things to do, such as movies or watching sporting events. So, just giving thought to if there's an additional draw, if people are on the fence about, do I really need to go to the cooling center? But if there's something fun to do, that might be an additional draw. So thanks for that comment, Tanya.
Yeah, and I'll say this is a great way to partner, with the business community and community-based organizations in your municipality. If you haven't, this is a sort of place where you can do some outreach ahead of these events and say, to those partners, would you guys be willing to be open, and would it be okay if we promoted the things that people can do while they're there to, have a purpose for going to your space besides just sitting in a corner in the AC, but like how can we brainstorm together some options that will draw people to that space and then help them stay there comfortably and want to be there as opposed to feeling like it's an effort to go and you don't really want to make that effort.
Totally. I think that's such a great idea. Um, we have another question about the number of deaths caused by heat can be misleadingly low because heat often triggers underlying strokes or heart attacks or respiratory failures. How does the Maine CDC track indirect heat casualties to get a true picture of heat impacts across the state?
That's a really good question, and it's a hard one to answer because like the question points out, it's not easy to do that. So there are sort of statistical techniques that we can use to assess the sort of, what we would expect to see on a given day for any type of, health outcome, whether it's emergency department visits for any reason or for a heat related reason or, deaths from specific causes or any causes, and compare what we see during a heat event period or at a certain temperature or heat index threshold to what we would have seen on a day with a more moderate set of weather conditions. Those analyses are time consuming and require a whole lot of data and sort of staff time to run. We did at Maine CDC perform that type of analysis with colleagues from New Hampshire and Rhode Island and Brown University about 9 years ago, and looked at the sort of the New England region, comparing sort of health outcomes, a variety of health outcomes across a range of different heat index values. And then we're able to look statistically and sort of compare, do a point to point comparison, looking at days when the heat index was 95 compared to days when the heat index was 75, and sort of do comparisons, looking at 10 or 20 years of data across the whole region. And what we were able to see with that analysis was something like about a 9 or 10% increase in emergency department visits and deaths from any cause on those really hot days when you compare them to the to the cooler days. So we know that impact is happening. It is a little bit hard to measure. We don't see very many directly heat-related deaths in the state. And part of that, I think, is, just medical coding practices vary somewhat region to region. We know that regions that are cool do not typically code deaths as heat related unless there's really, really clear evidence that heat was the sort of causative factor. And so it's not surprising that we don't see very many when we look at the data specifically for deaths that were directly heat caused. But we know that there's an impact. We can see it when we look at the data in other ways. When we have the time and the volume of data to do those types of analysis. And I think it's important for people to understand that those heat impacts can show up in different ways and look a little bit different. It might look like, severe dehydration. It might look like a heart attack. It might not look like just heat stroke, but those are heat deaths and other types of health outcomes that can be attributed back to being exposed to the stress from that extreme heat.
Totally. That's a great answer. And then we did get a question in the chat as well. Is there data related to behavioral health impacts with heat?
Anecdotally, from what we see, just combing through qualitative information about visits to the emergency department for heat-related illnesses specifically, yes, we can see a lot of overlap between mental and behavioral health outcomes and heat-related outcomes. We have not looked more formally at the data or done any analyses, but there's literature out there that shows those relationships, and we can see that playing out, whether it's just mental and behavioral health outcomes that are preventing people from recognizing that they're overheating or getting too cold in a not well modulated space, or whether it's medications that folks take for those conditions that interfere with the body's ability to regulate temperature that get in the way. We definitely see that overlap.
And I'll add that US CDC created a great resource for providers maybe 2 years ago that we've started to promote about people making a plan with their doctor for heat, for those antipsychotic medications or diuretics, things that will really increase their risk. So we can share that after the fact, but it's a nice little toolkit for both providers and patients.
Oh, cool. Yeah, if you could share that, that'd be awesome. We can include it in the follow-up email. That's something that I didn't even honestly consider. Wow. Yeah. Um, and on that note, or Robin, did you have one last question you wanted to ask? Or if not, I have one.
Yeah, I think we did have a question also about air quality and how extreme heat frequently triggers ground level ozone warnings in the greater Portland area and beyond. And so how residents with like underlying respiratory and health conditions can manage that air quality, low air quality levels.
Yeah, it's a great question. We do see those co-occurring events a lot. And it always feels like an unfair double whammy when we get both poor air quality events and hot weather at the same time. And there's some reasons that they happen together. The production of ozone is sort of helped and sped by hot weather. The chemical reactions in the air that produce the ozone happen faster when the air itself is hot. And so we do, when the air quality is already iffy and it's really hot, that can sort of tip us into a poor ozone day. We also see more co-occurrence in recent years of summertime wildfire smoke events, whether sort of near us regionally or smoke being transported from long distances to us. But when those co-occur again, it's really challenging because you may want to be recommending to people that they avoid the heat by exercising later in the evening, but that might actually be when some of the air pollutant levels are peaking. And so I think for folks in their communities being aware of both, especially if you have a respiratory or a cardiovascular health condition that you're managing, making sure that you're checking the weather as well as the air quality forecasts. And a lot of weather apps will give you both of those right in one place and let you know when it's going to be dangerous or potentially unhealthy conditions for either type of exposure. But we also know that exposure to both at once is sort of super additive. And so we can see that the health impacts from one or the other are much greater when you have both happening at once. And that means, of course, that a lot of the solutions that work for one work for the other. So if we're recommending that people stay indoors in an air-conditioned environment, that really helps with air quality too, because you're going to be filtering the air coming in and you're not going to be stressing your system from the extreme heat. So I think another thing to remember is whatever advice you're following for one will likely be beneficial for the other, and that it's all the more important to protect yourself if both types of exposures are happening on a given day.
And if you're checking out our main tracking network for the heat and cold ED visit, we also have air quality forecast data and smoke forecast data. So you can always go in there and see in near real time what the forecast or current air quality is for your area.
It's awesome. That's another resource we can share with everyone afterwards as well. Okay, I think that was all of our questions, unless anyone has a burning last question. And if not, we can always email you questions afterwards. Thank you so much for coming today. Or Megan, sorry, I see you're unmuted.
Oh, no, well, I was just to wrap things up, if there were one piece of advice you would want to give our attendees, like if they're looking out for their friends, families, and neighbors, what would you want to leave them with? The most impactful thing they might be able to do?
That is a hard question. It can be so many things, and I wonder if we have different answers, but I would say that mine is really just to be prepared ahead of time, kind of like Rebecca mentioned about the heat event in the Pacific Northwest and not being prepared. Sometimes it can feel like going through the motions is not worth it if people aren't showing up at cooling or warming centers. But it really is if it means that you're prepared and ready when something really bad happens. And I think sometimes a lot of public health can look um, invisible or it doesn't have a incredibly grand impact from the get-go, but it makes a big difference. Being prepared, having networks of communication established ahead of time. And a lot of it can be relationship building, just knowing that people are connected in your community and know where to access information. And I'll let Rebecca and Aaron elaborate if they have a different answer.
It's such a good question, and you can see that it's really hard to narrow it down to just one thing. I think I agree with CJ that I think, we hope that having this on people's radar early means that you can take steps to prepare and anticipate and protect your health, protect the health of folks you know who might be vulnerable or who you're responsible for in your communities. And I think the other thing is just making sure that you're helping people to recognize heat as a potential public health threat. I think it's very hard when we don't experience it a lot to both see it as sort of novel and a pleasant change from winter, or to sort of see it as like a thing that happens every, once in a while in the summers and a thing to get through rather than a really serious public health threat. And, um, you know, we see a big range in the types of heat events that we experience. Sometimes they're just a day and it just creeps up slightly above that advisory threshold and we get through it. But I think, recognizing that any kind of extreme heat in the wrong circumstances can be really dangerous and taking it seriously, especially if you or folks that you know or work with or care for fall into those groups that might be more vulnerable, just taking it seriously and recognizing that it can turn from a nice hot day to a really unpleasant day to a really dangerous day without you necessarily knowing where you're going. So take those prevention steps and take the weather seriously.
And to add to Rebecca's point, I think a fact that I find pretty compelling is that extreme heat nationally kills more people than hurricanes, floods, and tornadoes combined, which I think just the other things are much scarier up front. But like Rebecca said, extreme heat can be, it can get very dangerous before you necessarily know it's happening. And it really does have a very significant health impact when it does.
Totally. And I feel like in Maine, there's just a sentiment that it's like, oh, that's not something we have to worry about. We're a cold weather state. But no, it is totally something that we have to worry about. And if not, worry a little more because we're less prepared for it. Um, yeah. Erin, I don't know if you had something you wanted to add before we wrap up.
Just as the marketing person, order the guidebook so you have it on your shelf so you don't have to go scouring the internet. Just have it on your desk.
Yes, we're gonna do that. We need to get one. I'm sure the public health team has one already, but the sustainability office needs a copy too. Um, does anyone else have any last comments? I know we're a couple minutes over before we wrap up. If not, you can find this recording in the email afterwards and all the resources we talked about. And thank you so much, Rebecca, Erin, and CJ, for joining us. This was such a great discussion, and it's just a really awesome resource to have. So thank you.
Thank you guys so much for having us, and thanks everybody for joining.
Yeah,
Stay
thanks
Yeah.
cool.
everyone.
Thank you, everyone. Have a great day. Stay cool.
Stay cool.
Stay cool.